the NAMI Connects program started last year, February, kicked off, providing in-person peer support in the emergency department in support of crisis intervention, working with social workers, working with the ED staff. It was a new program, it was a pilot. I mean, a few other resources that tried to do it before. It was also an interesting time to do it. I mean, we're during the COVID pandemic, there's a lot going on. And I saw the opportunity come up and I thought to myself, like, hey, how cool would that have been if I'd been in the ED and there had been a peer there? So I thought, okay, I'll do this. And what that job looks like is providing, getting referrals from the crisis intervention specialists who are social workers to meet with someone who may be open to peer support. So it's not always they're 100% looking for a peer. They 100% want to engage in recovery. They're 100% ready. It's just they're open to having a conversation with somebody. And to give you all some data before I go into the story a little bit further, in the past year, we've met with close to 350 patients, reduced recidivism in the emergency department of Providence by 46.9%, which means 46.9% more people are connecting to resources, continuing on with their care, and not coming back to the ED. It's sort of hard for me to like wrap my head around that number because when I do this work, I don't think about statistics necessarily. I mean, I go into every single encounter, every single meeting, peer encounter, the same way, just looking to have a personal conversation with somebody about who they are, what's going on for them, and what they're thinking about, what they want to do next. The thing I learned not to do really quickly was I don't walk in the room and say, how are you doing? I say, what happened? What's your name? What's going on? Tell me about yourself. And the reason I do that is because I felt like it was sort of redundant to ask somebody in the emergency department. It would have certainly been redundant to me to ask me, like, how are you doing? Like, well, dude, I'm in the ED. Like, not that good. But our hope is to add a new element to what the hospital's doing to help social work out, add a new element to help someone feel like there's just someone there. So we don't wear scrubs, we have like a name tag and stuff, but we don't wear scrubs. We look like, to be fair, the first couple of months I was there, people thought I was a doctor or something because I was walking in jeans and a t-shirt. But we try to just look like a person that's just there. And of the 300 and so odd people, the one thing I heard the most was what they got out of it the most was just feeling like they weren't alone. And as someone who had gone through a similar process, who had gone through similar frustrations and the difficulty of navigating the healthcare system, the difficulty of understanding what care is, just accessing the care, someone to have a conversation with about contemplating sobriety, talking about mental health for the first time. What was most helpful? Just hearing someone say, I felt like a human being, I felt like I was seen, I think was, so statistics aside, when I think about what the success story is in that program, is that time in and time out, I'd hear someone say like, just thank you for coming in here. I feel a little more comfortable and a little safer. I feel like I'm not alone in this process. There's people out there that have gone through this. I feel a little bit of hope. I feel a little bit of faith. And maybe I don't feel those things yet, but I can imagine it. Part of our role is to meet someone, talk to them about what's going on. We also do advocacy with social work. Sometimes we'll advocate to ED docs with social work and things like that, as far as like helping someone get to inpatient, helping someone get to outside providers, maybe IOP. A few of the resources I've heard in this room, like NARA, places like that, like helping folks access those resources, know what they are and think about them. And so another big part of that is, once the introductions are done, once the conversation is flowing, help someone imagine what resources would be helpful for them, what resources they're feeling like are helpful for them, and also to explain and help them understand the resources that have been offered. Like inpatient, like I go up to inpatient, know what inpatient looks like. I've been inpatient. And so I'll talk about what inpatient looks like, what's going on up there, and start to set little goals. Like, hey, there's groups up there. Checking them out might be fun. Do you like art? There's an art group up there. Start to provide that encouragement about accessing care. Or if someone's like, hey, man, I don't know if I want to access care, that kind of stuff. Start to talk about what might be helpful, what's going on. Also to build the empowerment through this situation. A lot of times to access care and letting somebody know that I will still talk to them, I'll still be non-judgmental, accept who they are, and still see them the same if they say, I'm not ready yet. And I'll say, well, myself or one of us will be here. Just want you to know that we're here. we're out here. It's your choice. It's your decision. So what makes peer support different, I think, working in the emergency department that I did, like when I was doing peer support as part of a clinical program or part of a clinical BDN team or something like that, the VA, like in part of an ACT group or part of, a therapy program, something's going on where I was sort of modeling my participation in that group after I've been a participant, is that it adds this layer of like the non-provider person with lived experience part to it. As we were integrating with the emergency department, a lot of the work that I was doing, we were doing was helping the ED staff know like what peer support is, starting to see the value in it, meeting them where they're at and sort of, navigating what we can and can't do. And I was a little worried. I mean, I thought like when we went into it, it would be really hard. I thought there was going to be a lot of pushback and things like that. And there was a little bit. I mean, it's a new program, stuff's new. There's a lot going on in healthcare right now, but within a few months, as people started to see like what it looks like to sit down with somebody, have empathy for them, start meeting them like that, talk to them about that, get them they have these little Uncrustables. I don't know if you know what those are. Get somebody in Uncrustables, start, bridging the gap with somebody, helping them feel seen and comfortable. They saw that our program, our resources up here was supporting people in a way that oftentimes ED staff wish that they had more time to do. They're working with much more patients, they have much more responsibility as far as the healthcare goes, as far as meeting the patient, working with them. Whereas, we're sitting down for an hour with someone, sometimes talking to them just about life. And during that conversation, that's where we're gleaning out what their interests are, what some barriers are. Like, see if we can help them get a phone, a track phone at least, make a couple follow-ups with something, something to help them out. And then bringing that information to nursing and into the social workers, let them know also, like, here's an additional needs this individual has, so they can better advocate for that person as well. Helps them out. And so, after a few months, they decided like, hey, let's keep this going. Let's do this some more. So the real value, I think, is add something that I legitimately feel like shouldn't be unique necessarily, but I can understand what time requirements, but adding this human element, talking about lived experience, talking about being vulnerable, talking about my own life with someone in a way that's empowering, in a way that helps them feel like someone has actually been through it, is talking to them and has their back and sitting there with them. And then on the ED staff side, a lot of them wish, hey man, I wish I could sit there and talk about what has gone on in my life, like what informed me and my process to become a social worker, become a nurse, and things. So thanks for going in there and doing that and helping someone know, that we all have a story, stuff going on with all of us, and allowing that to empower someone and really hearing their story and getting their story out there.